What about the tube? The tube that runs down through the middle of my horse, the gut. Surely that's too far away from the spine for chiropractic to help gut issues.
But the gut is also innervated and is also signaled by vagal nerve. Our vagal tone is responsible for all of the internal organ systems. And so keeping that vagal tone normal, keeping the normal signal with the neurotransmitters to each of those internal organs normal is what does things like prevents colic in the fall, prevents Cushing's as the horse ages, prevents, of all things, laminitis. Because what it does is it helps regulate normal release of neurotransmitters. Neurotransmitters are chemicals that fire at the ends of the nerve signal functions to each organ system. They vary from organ to organ and from type of response that the body is looking for. But if we keep those neurotransmitters at a normal rate and normal level by keeping the nerve function that exits the spine, that exits the brain, moving like it should, we can actually alleviate dysfunction in the metabolism. We can alleviate dysfunction in neurotransmitters that cause GI tract motility. A lot of the GI tract dysfunction that we see in the fall and in the spring is related to inappropriate neurotransmitters all year long. When we have decreased neurotransmitter to those areas all year long, those animals, as they come into the fall and begin to lower their metabolism so that they can grow hair and gain weight like a normal horse for the winter, also experience the same depression of metabolism that normal horses do. But they're already at a lower level, so they experience even more depression of neurotransmitter release. Guess what happens? Their GI tract gets out the remote, sits by the TV, and doesn't do anything else. So if we keep those neurotransmitters functioning like normal all year long, we can actually prevent those colics on the seasonal changes. The hardest thing to ever prove to someone is that their horse didn't colic because of it. And it's sometimes the happiest thing that you cannot prove to them.
Okay, all right. So we started up at the top. We've got all the head issues that we dealt with. We got the lung, the coughing, the heart, the GI tract. What about the kidneys, bladder? What about some of those things?
Well, kidneys and bladder are related to acid-base balance in the animal. And their function is also regulated by normal neurotransmitters. But, and this is something we didn't mention when we talked about heart, there's also a communication system between the kidney and the heart that help to regulate little important things like blood flow, blood volume, and blood pressure. And so, keeping normal vagal tone to the heart, normal tone to the bladder and the kidneys, helping keep all of these neurotransmitters at a normal level all year long, helps to reduce stress, helps horses recover from that initial response to stress. You can think of it as helping keeping them more level-headed. You know, you have friends who, when something happens that's really emotional, they just fly off the handle and they carry on about it for months and months and months. And 6 months after you've forgotten about it, they still are bringing it up. Those, like some of our horses, are still reliving those stress episodes. But animals who have a normal everyday, regular release of all these neurotransmitters, of all these nerve functions that exit the spine at a normal rate, that don't have decreased blood flow because that spinal segment is not functioning because it has muscle spasms surrounding it. Those horses are going to rebound from those from those acute situations much more easily, and they're not going to carry it forward to affect blood pressure, heart rate, blood volume, urine output. They're not going to dehydrate as easily. They're not going to become as acidic because they're breathing faster every time they think about the potential of something going wrong. So, does it affect behavior? Absolutely. And what it does is it helps make them more stable individuals.
All right. I think I've got the last one. And I don't think you can help it. I have a breeding program. My conception rate and my live delivery rates just aren't what they should be.
You need to chiropractically adjust your horse. All of them. Stallions included.
No.
Absolutely. Why? The nerve response you have to remember that sensory input to the brain causes motor output to the tissue. All of the tissue, including those that you can't see or feel or necessarily even think about because you don't really know what they look like. Oftentimes I'll say to my clients, I want y'all to just stand there and feel your appendix. Don't touch it, just feel it. Most of them look at me a little funny because most of us don't think about our appendix every day. All right? But in animals, in everyone, there is sensory input to the brain from all of those organ systems, and there's motor output to them. The uterus has smooth muscle and lymphatic tissue. And if that smooth muscle isn't working like it should, it can't drain well, so it won't be ready for conception. The testicles, same deal. If there's muscle spasm in the back of the horse surrounding the spine, where the sensory input from the testicles comes in and where motor output to the surrounding tissue goes out, is impinged on, they won't get normal signal. And so, you won't have normal you won't have normal sperm production either. So, can I fix everything with chiropractic?
Almost. It seems like we can really help. And we both believe that. And I was just playing the devil's advocate today because my practice is 90% chiropractic care. Dr. Amy's practice is 70% chiropractic care. We would like you to use chiropractic care to help you harmonize your horse's health, and to find a chiropractor in your area, you should go to
obviously the AVCA, or American Veterinary Chiropractic Association doctors.com, where you can find chiropractors who are trained animal chiropractors in animal chiropractic.